or tune it in the sun. This is TFM. Get ready to rock from AM to PM. Come on, let's talk.
Presenting TFM. The most happening music, the most important news, and most importantly, your views. At Times of Oman radio station. TFM. Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to the Midday Update. These are the breaking news stories. The Ministry of Health today announced the registration of 5 new COVID-19 deaths in Oman. The death toll has now touched 218 in Oman due to the virus so far, the officials at the ministry informed. They have also extended their deepest condolences to the families of the deceased. The Ministry of Health announced the registration of 1,557 new COVID-19 cases in Oman on Monday. Amongst the new cases, 500 are non-Omanis and 1,057 are Omanis. The total cases in the country has now touched 47,735, which includes 29,146 recoveries and 218 deaths, according to the Ministry of Health. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health, as well as staying at home and not going out unless necessary. Those were the COVID-19 updates. We'll take a short commercial break and we'll be right back. Welcome back to the Midday Update. The South Al-Sharqiya Police Command has arrested 3 people on charges of illegal hunting. A statement issued online by the Royal Oman Police said, South Al-Sharqiya Police Command arrests 3 people on the charge of hunting Arabian caribou and violating the Environment Protection Law in Jabal Kahwan Reserve in the Wilayat of Jalan Bani Bu Hassan, and the case is under process. The Public Authority for Civil Defence and Ambulance dealt with 369 drowning accidents in 2019, which increased by 30% over the past year. Last week, Pagda reported a drowning accident of 2 citizens in Wilayat of Saham, where one person has been rescued and the body of the other man found after 16 hours. Pagda officials said in a statement, drownings are frequent accidents, especially during summer, where people head to valleys and beaches to escape the hot air and to enjoy nature. But among them are those who are not good at swimming, even adults or children. According to the statistics issued by PACTA, during 2019, 369 drowning accidents were reported compared to 225 accidents in 2018. That is an increase of 144 accidents. The places that record frequent cases of drowning are wadis, beaches, water channels, dams, ponds, wells, open water reservoirs, crossing the wadis during the rains, and water pools after the rains. The causes of drowning accidents are generally attributed to the lack of swimming skills, as well as swimming in unallocated places such as agricultural ponds, dams, water channels, and dangerous water pools, in addition to the random rescue that sometimes leads to more than one person drowning at the same time, Pagda added. The failure to monitor children during trips near bodies of water and non-compliance with guidelines, as well as the risk of crossing valleys while running, are additional causes for such incidents. To reduce drowning accidents, the PACDA calls upon all to follow safety instructions that include swimming in places designated for that. In the event that swimming pools are used on farms or homes, they must be provided with fixed ladders and metal handlers distributed over the circumference of the pool. Life jackets and swimming jackets must be provided, and the swimming pool should be fully filled in the event that it is used by children. A person who is able to swim should be present to monitor children while they are swimming. The authority concluded their statement saying that you must ensure that the pool is free of children when leaving the place, and when necessary, call the emergency phone 9999 or 24343 We wish you all a safe summer. Employees on leaving a company are entitled to end of service benefits. This is according to the Oman's labor law, a legal expert practicing in the country has said. End-of-service benefits include a gratuity owed to an employee, which is calculated on the amount of time he or she spent working for the employer, said Yasin Chaudhry, partner and head of corporate advisory at Al Faqih & Co., a legal consultancy firm in the Sultanate. The entitlements available to an employer on completion of his job are listed as part of the employment contract signed by him on beginning work with the company. Generally, under the law of employment of Oman, when we talk about end-of-service benefits, we refer to it as gratuity. He explained. Therefore, an employee who serves a certain amount of time with an employer is entitled to receive a certain percentage of amount from the employer upon termination of his employment. About calculation of gratuity, it depends on how many years that particular employee has served that employer, added Chaudhary. If he or she has served a period of 3 years, then that employee will receive 15 days of basic salary that he or she has last drawn for every year served. So it will be 45 days in total for the first 3 years, and from the 4th year onwards, they will be getting a full month's basic salary for each year served. That's how you calculate gratuity or end-of-service benefits. Employees in Oman, irrespective of whether they are employed on short-term or fixed-term contracts or long-term indefinite ones, are entitled to receive their end-of-service benefits, which, in addition to the gratuity owed to them, could also contain other benefits. Regarding whether an employee is entitled to end-of-service benefits, it doesn't matter whether the term he served was definite or indefinite, explained Chaudhary. Under any kind of contract of employment, when the employee has served for a period of at least 1 year, he will be entitled to receive his gratuity. When we talk about end-of-service benefit, it's not just about gratuity, he added. There are other things which an employee can ask for upon termination if they are due. For example, if there is any unpaid salary that is due, then that gets added to the end-of-service benefit, which an employer is bound to clear. Chaudhary went on to say, if there is any unused annual leave, then the employee can ask for compensation in place of that unused leave. Employees who intend to leave their company are also entitled to receive from their employers a letter of experience which can be used to help them find work in the future. Even upon termination, as per the labor law, the employee is entitled to receive a certificate of experience explaining his position, his remuneration, and his performance to the advantage of the employee, explained Chaudhary. This is a good benefit to the employee because even if the employer acts hostile, he is not at liberty to put anything in this letter that will be of disadvantage to the employee. This certificate of employment or character certificate will help the employee take up another job with another employer, he added. The employer is bound by law under the labor law of Oman to provide a certificate. Those were the news stories. We'll be back with our guest after a short commercial break. Welcome back to the Midday Update. Today, we're talking about dental care during pregnancy. Why is it so important? How does pregnancy affect our teeth? And more questions that our doctors will be addressing. Of course, we'll be joined by Dr. Norma, Naser and Dr. Zainab Al-Fadli, who are general dentists at Essa Dental Center. We'll speak to Dr. Zainab first. Dr. Zainab, welcome to the show. It's always a pleasure to have you.
Thank you, same mine.
Dr. Zainab, before we start discussing the topic, I wanted to ask you, what is the most satisfying thing about your profession?
Well, the most satisfying thing that I see from my patient is when I relieve their pain, the main complaint that they came for. And of course, when I see them smiling again after their procedure and they're happily and satisfied about the outcomes of the treatment, that of course gives me a high pleasure.
I can all for the smiles. And Dr. Zainab, how many patients are you seeing at present in a day?
Yeah, well, so far we are following the MOH guidelines regarding to seeing patients, the number of patients and number of staff in the clinic. We reduce the number of staff, the number of hours that the clinic is open, and of course the number of patients. And that's because we need to see a limited number of patients, so we can keep some time between each patient, so we can sterilize the room and have a good time
You
gap
need to be ready
between each
patient. Yes, absolutely. All right, Dr.
for their
Zainab,
safety, of course.
yes. Dr. Zainab, we'll get to the main topic now. Tell me,
Yeah.
why is it so important to take care of your dental health, especially during pregnancy?
Although many pregnant ladies, they pass their whole 9 months without any complaints, but some of the condition they might get worse actually during pregnancy, or they might develop new ones. It's an old wife say, or an old wife tale, says that going to the dentist carries a high risk for the baby and the moms to be, which is actually the opposite is true. Going to the dentist is very important during pregnancy because your body is the hormones in your body is reacting differently than if you are not pregnant, and to perform or to have a good oral hygiene is actually is part of a healthy lifestyle, as the mouth is a gateway to your blood vessels, to your digestive system. So keeping a good oral hygiene is actually is actually an indicator for a good health overall.
And during pregnancy, does your teeth get weaker? Do your teeth get weaker? Like, is it just a myth, or is it actually what happens?
During pregnancy, you can develop some of dental problems more. It will be obvious more, especially like gum disease or dental cavities. It's still an old wives' tale that with every pregnancy you lose a tooth, which is false.
That would be terrible.
Your mouth during exactly. Your mouth during pregnancy, because of changes of hormones, your body is susceptible for some kind of new dental problems. For example, your mouth can have what we call pregnancy gingivitis, which is an inflammation of the gum, and that causes swelling, tenderness to the gum. And the pregnant lady will notice that she's bleeding more when she brushes or when she floss. Actually, if we leave this problem untreated, this will cause, or this will lead actually to more severe dental or gum problems. As per that, the dentist has to do regular checkups and to do more frequent cleanups to her teeth during pregnancy.
And what about tooth decay? Is that also a problem?
Of course, tooth decay is problem to the pregnant ladies because tooth decay happens with them for many reasons. First, the pregnant ladies, because of the high consumption of carbohydrates in her diet, that will lead to dental decay. Second, because of morning sickness that she faces, that high level or high amount of acid that comes from the stomach will be in her mouth, and this will lead to wearing off the outer layer of her teeth, the enamel, and also will lead to dental decay. For her, during pregnancy, her hormone levels are high, and this will affect her response or her body response to what we call plaque. Plaque is the layer that thin layer on the teeth that contains germs and will also cause dental decay.
Doctor, just a quick question here. You mentioned that when they throw up, that causes teeth problems. Does it make your teeth yellow? Because that's, again, is it a myth or does it really happen that when some people have a tendency to throw up easy? So does that affect your tooth color?
Not tooth color, but affects the tooth structure itself, because the acidity that comes from the stomach is very acid and it's really strong on the tooth structure. It will not handle. It will actually soften the tooth structure and lead to wearing off. So in future, if it's actually more than if it's very frequent, it's not just during pregnancy. Maybe she will have the same problem before or after her pregnancy. We have to check her dental health, the structure of her teeth actually, and this will make it weaker by time, will lead to several problems starting from tooth decay.
And how can we prevent all of this? Is it possible to prevent all of this?
Prevention actually is better than cure in general, and with dental problems, the it's easier to when it's found, or it's when it's diagnosed earlier, it will be easier to be managed, and the treatment will be easy for both the dentist and the patient himself. As for pregnancy, if the lady is in the process of trying to get pregnant, it's always a good idea for her to go to her dentist to do regular checkups. And if there is any problem that need to be cured or solved before her pregnancy, that would be even better. During pregnancy, if she's pregnant, her dentist will actually ask her to go to do more thorough cleaning for her teeth in the dental office, and will teach her good or a new brushing method that to keep her teeth clean at home.
And what are your top tips that you'd want to give to your patients who are pregnant and who could develop some dental problems? Your top tips.
Yeah. The top tips actually for pregnant ladies and for non-pregnant, but for pregnant ladies, first she has to keep her teeth clean and her oral hygiene perfect, at least to brush, for example, twice a day for 2 minutes with fluoridated toothpaste, and ask her dentist to teach her the good right methods to remove the food debris and the plaque by brushing. Use small-headed brush with soft bristles, the one that's easy for the patient or for the pregnant lady to handle. Floss, dental floss, to remove the small food debris or bits that's between the teeth, at least once a day before bedtime. Avoid sugary drinks and fizzy drinks or sugary teas, and keep it to the mealtime at least. If you're hungry, if the patient is hungry, if the lady is hungry and she wants to snack between her meal, she can substitute the other unhealthy snacks with fresh fruits, vegetables, plain yogurt, anything that's not sugary and not acidic. So she will prevent that to damage her teeth. Avoid mouthwashes with alcohol. Avoid smoking, of course. This will make her gum disease even worse, and of course it has a big risk on her baby as well. And also use salty rinses, which means like she can use 1 tablespoon of salt with a cup of warm water. Use it as a rinse few times a day, and gargle with it and spit it out without swallowing it. This will reduce her gum inflammation. And also with the morning sickness. The morning sickness is actually the nausea and the vomiting she has. In order to reduce the damage to the teeth, it's recommended for the pregnant lady to rinse with plain water right afterward her sick, and avoid brushing her teeth directly, because the acid will soften her tooth structure, and this will lead to more problems for her teeth, general teeth. It's better to brush after 1 hour.
Excellent tips, doctor. Something for our viewers to take away. All right, Dr. Zainab, thank you so much. We'll take a short commercial break and we'll be back to Dr. Norma Naser.
Thank you for having me.
Welcome back. We just spoke to Dr. Zainab, and now we have with us Dr. Norma Naser. Dr. Norma, welcome to the show.
Thank you.
Dr. Norma, as we heard Dr. Zainab speak about teeth getting weaker, tooth decay, she also gave some excellent tips about how to keep your mouth, how to practice good oral hygiene. But, as they say, complications do arise. No matter how much we try,
Yes.
there's always a risk of complications. So, can a woman get dental treatment during pregnancy in case she does have any trouble? Is it safe for them to get treatment during pregnancy? And what kind of treatment is all right?
First of all, you have to make sure to inform the dentist that you're pregnant. Usually, dental treatment can be done at any stage during pregnancy. But the ideal time is during the second trimester, which is from week 14 to 20. Usually we prefer the second trimester if it's an elective procedure, because the first trimester have the problem that the baby is still developing, the organ of the fetus is not complete, and the side effects that can rise is high. And in the third trimester, the problem we have is when the baby is growing, the nausea, the postural problem will be there in the mother. So, for example, if she comes to the clinic and you put her in supine position or recline, it may be cause discomfort for her. So that's why the second trimester is the most ideal. This is if we're talking about elective procedures. Of course, if the pregnant lady have a pain or have a swelling, then an emergency treatment should be done, regardless if she's in the first or second or even third trimester.
And what about in the case of pulling out a tooth? Is that something that you can do when a lady is pregnant?
Many doctors don't prefer to do extractions for the pregnant lady because there is some amount of stress or pain that happens with the extraction, and it might somehow affect the growing baby. This, of course, if there's no pain. But if the condition is bad, if there is severe pain, if there is a swelling or infection, we cannot delay the procedure. We will have to do the extraction in any trimester just to solve the problem. As Dr. Zainab mentioned, you have to see your dentist if you're trying to get pregnant or in your early pregnancy. We don't want you to go and visit the dentist with a severe pain. We can check the patient before having any problem. If there is any possible problem that will rise, we can schedule the treatment, as we said, in the second trimester, and not have to do it as an emergency procedure.
Pre-planning is always great. So, doctor, we spoke about pain. So, what about dental anesthesia? Is it something that is safe during pregnancy?
If you're pregnant and you have to do a filling or a root canal or an extraction, you don't have to worry at all about the numbing medicine that we use. The anesthesia is completely safe to the mother and the baby. So that's not something you need to worry about.
And dental x-rays, what do you have to say about that?
Dental x-rays, usually we cannot say it's harmful because the dose is very low, let's say, and the risk from getting one individual x-ray is very low. So usually we can do x-ray even if you are pregnant. Still, the doctor or the hygienist will make sure that your abdomen is covered with a leaded apron. That lead apron will protect you from the x-ray radiation. Also, they will make sure that your neck is covered with a leaded collar also to protect your thyroid gland during the x-ray taking.
A lot of precautions need to be taken, especially if you're pregnant. So, what kind of medicines are safe? Do you prescribe what you would otherwise prescribe, or is there something different?
Of course, when we prescribe any medicine for any patients, we have to follow precautions. With the pregnant dental patient, we have to be more careful because the priority here is for the baby. We have to make sure that the medicine is safe for the baby. So you don't have to worry about that. We have a range of medicines, whether it's antibiotic or analgesics, that are completely safe to use during pregnancy. The dentist will make sure to prescribe the appropriate medicine for your problem, and it will not affect your baby at all.
And is it possible for dental diseases to have an effect on the child?
Unfortunately, yes. Research has found a very, let's say, strong relationship between the gum disease in the expectant mother or the pregnant lady and premature baby. So if the mother has a gum problem and she does not get it treated, then the risk of having a premature baby with low birth weight is higher. Premature baby, it's a problem, of course, because along with it, there is a risk of range of problems like cerebral palsy, like problem in eyesight and hearing. So it's very important for a pregnant mother to get all the treatments, especially gum problems, and not to postpone the treatment until after delivery. If she has a problem, she has to go and get it treated as soon as possible.
Yes, that can be quite critical. So, doctor, on a lighter note, as a dentist, what are some practices that you abide by?
Of course, as a dentist, I have to follow strict oral hygiene measures. My daily routine is brushing twice a day minimum, 2 to 3 times a day. The first time of brushing, I keep telling my patient, it's not when you wake up from sleeping. It's after your breakfast. So you have to have your breakfast, then brush your teeth. Brushing, the idea of brushing is to remove the food debris from between your teeth. So if you do it when you wake up, then have a breakfast, then the food debris is there. If you then went to work on anything, then for a long time that food debris, bacteria will be in your mouth and cause dental problems. Also, I use an electric toothbrush. Few years back, I started using it electric, and it's actually, it gives better cleaning than the normal toothbrush. Also, you can control the pressure because it's not allowed to use a very high pressure during brushing. So in the electric toothbrush, it's automatic. You just put it on your teeth, and the amount of pressure is already there in the toothbrush. The brushing time itself, ideally, it should be 4 minutes. Maybe it's a little bit long, but let's say minimum it should be 2 minutes to make sure that you're covering all the tooth surface. You're not missing any area, and you're cleaning all the teeth in a proper way. Also, I'm using a mouthwash once or twice a day, and flossing once a day before bedtime is a must. And also, of course, regular checkups with the dentist every 6 months, let's say.
In this case, doctor, if you don't practice what you preach, it will show because you can't really hide your teeth. So does that put pressure on you of being judged?
Actually, yes, but what happens is that when you're studying dentistry, like in your early, let's say, college life, during the 4th year, you start knowing more about the dental problems. And what happens is that you start checking what problems you have, and you try to solve it, let's say, as soon as possible. So during the college life, lots of my colleagues or myself, we got orthodontic treatment, fillings, root canals. So the moment we finished the dental school, let's say all the problems are solved. So what we need to do is only monitoring. We're following strict oral hygiene measures. For myself, I'm getting a regular checkups, regular cleaning every 6 months by my colleague, Dr. Zainab. So this is enough if you solved all the problem previously. And of course, as you said, the smile, it's nothing that you can hide. So when you're smiling, let's say comfortably, and you have a nice smile, then will reflect on your patient. They will tell you, I want to smile like your smile. Yes.
So you heard it. That is why dentists always have a good smile, right, Dr. Norma?
Yes.
Thank you so much, Dr. Norma. It's a pleasure speaking to you as always. Thank you so much for being on the show.
Thank you. Thank you.
Well, that's it for our episode today. We'll be back tomorrow at the same time, so keep watching.